So, good morning my dear students. Today I am going to discuss regarding non-metallic poison. So, previous classes which we have discussed, that was very important topic: arsenic poisoning, lead poisoning, mercury poisoning, iron poisoning, copper poisoning. So, these are important metals which we have discussed. Now, today the non-metal poison, non-metallic irritant poisons, that is phosphorus. Only we will know regarding the phosphorus. So, our syllabus for the undergraduate, metallic poisons which we have discussed, a lot of metals you know, but we do not discuss regarding all the metals, only which we have discussed, that is sufficient. Now, non-metallic only phosphorus, you have to know regarding details of phosphorus. So, phosphorus, you know that the phosphorus is inflammable or inflammable substance. Inflammable substance, when it comes contact with the oxygen, they are acting like explosive substances, and you know that a lot of missiles, a lot of ballistics, a lot of bomb, explosive substances where the phosphorus are used, and it is so much inflammable substance. So, our category of phosphorus are two types. One is the white phosphorus or crystalline phosphorus, or crystalline phosphorus. This white phosphorus, they are used in the fertilizer, basically fertilizer, insecticides poisons, rodenticides poisons. You know that organophosphates compounds, organophosphates compounds where the phosphorus is also present. So, these are basically fertilizers, insecticides poisons, rodenticides poisons, incendiary bombs, I have already told, smoke screens and fireworks. It has a garlic smell. I have already discussed in the general toxicology class that the garlic odor is due to the phosphorus compounds. It may be found in the organophosphorus because the phosphorus is the component of the compounds, as well as the phosphorus itself. If it is white crystalline form, then it is garlic odor, and it is very much luminant or luminescent in the dark. When you are placing in a dark place, it is glowing, it is luminous, and it is insoluble in water. But you remember this, the white phosphorus is so toxic or much more toxic than the red phosphorus. So, samples of white phosphorus always contain some red phosphorus and therefore appear yellow when it is burned, basically. So, the white phosphorus, when it is burned, they are transformed into maybe some portion, it is yellow phosphorus, they are less toxic, and as because they are inflammable in the atmospheric air, they should be kept in a dark place and in the bottle cover where there is kerosene is present. So, you have to keep in a bottle with kerosene containing bottle. So, remember the explanatory question, why the phosphorus is kept in a kerosene containing bottle? Because of these things. These are inflammable substances. When they come contact with the light and the atmospheric air, they are producing the phosphorus pentoxide. Phosphorus binding with the oxygen, they are producing pentoxide, phosphorus pentoxide, and this phosphoric pentoxide, they are highly inflammable substances, explosive substances. So, it causes burst, explosion, burn injuries, chemical burns, etc. and etc. That is why they should be kept in a dark place and they should be kept in an inert form, just like keep in a kerosene containing bottle. But the red phosphorus, they are amorphous. There are two categories of phosphorus, white phosphorus and red phosphorus. Red phosphorus, they are amorphous in form. When I have already told, the white phosphorus, they are transformed into changes into the red phosphorus. This formation is accelerated by light and the heat. These red phosphorus are non-luminous, basically. They are odorless, they are tasteless, and also they are non-toxic or less toxic and non-inflammable substance basically. So, the difference between, you have to remember the difference between white phosphorus, white and red phosphorus. You have to remember these two important difference between question, very important, white phosphorus and red phosphorus difference between. So, very important question, very important, white phosphorus and red phosphorus. So, again I am saying the white phosphorus, they are inflammable substance, they are more toxic substance, they are crystalline, they are luminous. Red phosphorus, they are non-luminous, they are non-inflammable substances, they are odorless, they are tasteless, where the white phosphorus are garlic smell or odor, and red phosphorus they are which is in the matchbox, দেশলাইয়ের বক্স যেগুলো হয় তার গায়ে যেগুলো যে ফসফরাস থাকে, they are red phosphorus, non-toxic basically. Now, what is the mechanism of action or the action? You have to know that it is protoplasmic poison, means it has action over the protoplasm of the cell. So, it affects the cellular oxidation, the metabolism of the cells reduces, leading to necrobiosis, which is predominantly seen in the liver. So, the action is very important. So, they are protoplasmic poisons, they affect over the protoplasm of the cells in the form of cellular oxidation. The metabolism of the cells, they are reduced, leading to the necrobiosis, which are predominantly found in the liver cells or hepatocytes basically. Now, we are going to discuss regarding the signs and the symptoms. Signs and symptoms. Signs and symptoms. So, what will be the signs and the symptoms? Basically, it is categorized into fulminating type, fulminant poisons. You know that when a huge amount of poisons they are taken in a large single doses, then suddenly there will be the cardiovascular collapse, renal failure, and person will die immediately. That is basically any kind of fulminating poisons when we are taking the single large dose 10 or 15 times than the therapeutic dose and much more higher than the lethal dose or fatal dose, then they causes the death. So, death occurs within 12 hours, may be seen when the person is taking a large dose of this phosphorus. Early death is due to the cardiac arrhythmia. Basically, the person they are died due to the cardiac arrhythmia, cardiovascular collapse. Hypocalcemia, electrolyte disbalance, hyperkalemia. Death after the first 24 hours is due to the hepatic failure and cardiovascular collapse. So, basically the persons they are died due to the cardiovascular collapse immediately. If the persons they are died after 24 hours, then probably due to the hepatic failure. Now, we are discussing regarding the acute poisoning. So, you know that the acute poisoning and the chronic poisoning. So, acute poisoning is what will be the signs and the symptoms. Acute poisoning, it has two phases. Initially, the local action on the GI tract if it is taken orally, and half an hour to 6 hours or later the absorption of the poisons occurs to the GI tract, and usually which is occurring after 2 to 3 days. The first stage, what is going on in the first stage, the skin contact. Suppose this phosphorus come in contact with the skin of our body, then it is so much painful, and it is, if it penetrate, then it produces second and third degree burn, because I have already told this produces the chemical burn. So, it is produced severe painful burn injury if it come contact with the surface of our body like the skin or any other areas. If it is ingested, then there will be severe burning pain over the throat, over the mouth, intense thirst, nausea and increased vomiting, diarrhea and abdominal pain. The breathings, the vomiters, the feces may have garlic smell or odor. Luminescent smoking, vomitus, it is very important character that when the vomitus is coming out, when the feces is coming out, there will be the luminous character of this content and smoking like these things. These are diagnostic features. A symptom free period lasts for 2 to 3 days. It is seen after acute attack. That means the second stage. So, the first stage we have discussed when it is taken orally. So, they are producing severe pain etc. and etc. over the throat, over the GI tract, over the gastric mucosa etc., abdominal pain, vomiting etc. When it comes contact with the skin, they are producing severe chemical burn injury, maybe second or third degree. Second stage is the stage after the first stage, usually they are the symptom free period. These are symptom free period. I have already discussed here the symptom free period lasting for 2 to 3 days after the first stage. So, after the first stage 2 to 3 days there will be usually symptom free, the person is quite more or less okay, no abdominal pain, no vomiting etc. Again in the third stage same thing is happening and it is exaggerated forms in the first stage. So, increased vomiting, increased nausea, there will be the hematemesis, there will be the diarrhea, there will be the hepatomegaly, jaundice, pruritus over the body, itching over the body, there will be scanty urine, oliguria, renal failure, there will be the hematuria, there will be albuminuria, anuria also. So, person will die due to the renal failure. CNS manifestations where there is a found the restlessness, anxiety, insomnia, headache, confusion, hallucination, convulsion, delirium and coma. Next we have to know the what is the fatal dose. Fatal dose of phosphorus is 60 to 120 milligram of white phosphorus, because these white phosphorus are much more toxic. Our syllabus, it is much more important for the white phosphorus, not the red phosphorus. Fatal period is within 24 hours, but the person may die before 24 hours also if it is a fulminating poisons, and if it is a acute poisons or is a chronic poisons, the fatality will be increased up to 2 to 8 days. How will you diagnose? The diagnosis depend, I have already told, when the phosphorus come contact with the body, then they are producing some degrees of the skin burn, maybe in the second or third degree burn and luminescent, and it is smoking in character. If the vomitus is coming out or stool, you can smell that it is garlic odor, and GI tract will show the biliary damage characterized by yellow phosphorus poisoning, hepatobiliary damage, maybe in the form of jaundice, maybe in the form of the hepatic failure, hepatomegaly, fatty liver, this you may see. What will be the treatment of the acute poisoning? The treatment in the acute poisoning will be, first is the life support. If the person severe burning pain over the throat, respiratory distress, severe abdominal pain, then you have to give the life support, maintenance of the airway, because there will be increased inflammation and swelling. So, there may be chance of blockage of this respiratory tract. So, airway support maintains the airway, maintenance of breathing, ABCD, maintenance of airway, maintenance of the breathing, circulation, whether the circulation is normal or not, because it causes cardiovascular collapse, cardiac dysarrhythmia or arrhythmia. So, you have to know these things, and electrolyte imbalance you have to correct these things, because it can produce the hypocalcemia or hyperkalemia. So, you have to maintain the electrolyte balance, you have to correct if there is any imbalance. Next, the gastric lavage, very important explain why question. In phosphorus poisoning, why the potassium permanganate solution is given for the purpose of treatment? It's a very important explain why question. It is given in the 3 or 4 university exam explain why question. In phosphorus poisoning, potassium permanganate is used for the purpose of treatment. Why? Because in the gastric levels, the dilution is 1:5000 dilution of the solution of potassium permanganate. This potassium permanganate is the chemical antidote of phosphorus poisoning. Why it is used as a chemical antidote? Because it oxidizes the phosphorus into harmless phosphoric acid and phosphate. So, they are producing the harmless phosphoric acid and phosphate, and they will be excreted in the urine or through the bile and the stools. So, that is why the potassium permanganate is used as a chemical antidote. So, when we have discussed regarding the antidote, the chemical antidote, then it is the best example of the chemical antidote, that is the potassium permanganate is used 1:5000 dilution. It is very important, 1:5000 dilution in treatment of phosphorus poisoning, because it can oxidizes into the harmless phosphoric acid and the phosphate. Next, again the thing is that, again explain why question, why in phosphorus poisoning the copper sulphate used for the treatment, or for the purpose of treatment of phosphorus poisoning copper sulphate is used, explain why. So, why it is used? Because you know that the stomach wash, to remove the unabsorbed poisons from the body, the stomach wash is given in the form of 0.2% copper sulphate solution. Everything is important. The 0.2% copper sulphate solution or 0.2 gram of copper sulphate every 5 minutes interval. Why? Because it coats the phosphorus particle, coating, so that it does not come contact with the gastric mucosa directly. So, it produces one coating, one cover surrounding the phosphorus particles, or make a film of copper phosphide coating. So, copper phosphide coating surrounding the gastric mucosa, which is harmless and it cannot be absorbed in the gastric mucosa. So, that is why this copper sulphate is used. So, copper phosphide or cupric phosphide. So, these two examples very important, why the potassium permanganate is used for the treatment of phosphorus, why the copper sulphate 0.2% solution is used, means to remove the unabsorbed poisons from the body, means from the gastric content, from the stomach, because it is producing one coating or one layer, one protective barrier in between the gastric mucosa and the phosphorus in the form of cupric phosphide coating. So, it is harmless, it does not come contact or does not absorb in the gastric mucosa. Then the activated charcoal, you know that it adsorbs the phosphorus power, not absorb, it is adsorbing power. So, the activated charcoal has the power of adsorption, AD not AB, adsorption of the particles, so that it does not come contact with the gastric mucosa. Now, demulsion drinks like the oily substances, fatty substances are contraindicated, as the phosphorus get dissolved into these things. So, if you are adding the demulsion drinks, then it will be dissolved rapidly in the oily substances. So, do not give the demulsion drinks. Next, the purgatives is important in the form of magnesium sulphate to remove the absorbed poisons which are present in the GI tract in the form of stool or in the form of diarrhea. Next, you have to give the vitamin K, because I have already told they causes the hemorrhagic manifestation in the body, they causes hematemesis, they causes hemoptysis, they causes hematuria. So, you have to give the vitamin K, which acts as a clotting factors, anti-hemorrhagic factors basically. They reduces the hemorrhage. In the IV 20 mg or blood transfusion is given. The transfusion of the glucose saline and the plasma with vitamins is very important to protect the liver if there is hepatic failure and person is going to the shock. Then the hemodialysis or the peritoneal dialysis is very important to correct the hyperkalemia, hyperphosphatemia, hypocalcemia. Next, the N-acetylcysteine, it is important to help the liver basically. If there is jaundice, if there is hepatic failure, N-acetylcysteine is very important treatment, is a drug which are used to protect the liver. So, the external burns, if it is there, if the body come contact with this phosphorus, then you have to wash the areas with normal saline, you have to give the local antibiotic, you have to give the proper treatment of the local area and give the treatment of the burn injuries, just like in burn patient. Now, what will be the post-mortem findings? If the person is died due to the phosphorus poisoning, whether it is accidental poisoning or whether it is homicidal poisoning, whatever it may be, if the person is died, then as a forensic expert you have to do the post-mortem examination. What we will see in the dead body in the externally, outward, not dissection. So, externally what we are watching? We are watching that the person is emaciated, there is purpuric hemorrhagic spot over the skins of the body, there will be the jaundice over the faces, over the hands, fingers, the smell is coming out through the mouth, there is a garlic odor smell is coming out. So, it is very important parameter, garlic odors coming from the mouth. Mucous membrane of the mouth is corroded. There will be the hypostasis, mean the post-mortem color will be dark brown. You know that in phosphorus poisoning the post-mortem hypostasis or PM staining will be dark brown. So, these are the external important findings: mucous membrane, PM staining, garlic odor and emaciation, purpuric hemorrhagic spot over the body. Now, the internal findings, what you will see when you are dissecting the body, you will see that in the GI tract there will be the mucous membrane, there will be multiple petechial hemorrhagic spot over the mucous membrane of the GI tract. There will be the multiple hemorrhages over the muscles, serosa, mucosal membrane, respiratory tract, over the liver, over the kidney and as well as over the endocardial hemorrhages, pericardial hemorrhages, epicardial hemorrhages, peritoneal hemorrhages, lungs and the brains will be involved and will be intense congestion over the lungs and the brain. The stomach and the intestine, what we will see when you are dissecting the stomach and you are observing that things, that the mucous membrane are yellowish or greyish white in color. The mucous membrane is so soft, thickened, inflamed and corroded with patches. Maybe if it is unabsorbed, then the luminous materials is present as a gastric content of the stomach. So, the luminous substances will be present if it is not absorbed in the stomach, and the smell will be garlic odor. So, here it is confirmed that if a patient come in the emergency with the history of the burn injuries over the surface of the body, garlic smell or odor is coming out from his mouth or from her mouth, multiple petechial hemorrhagic spot over the bodies, what will be your probable diagnosis? The probable diagnosis is phosphorus poisoning, because these are the cardinal features of phosphorus, where there is the garlic odor, whether there is the intense burn injuries, chemical burn. In case of organous phosphorus poisoning, maybe the garlic odor or kerosene like smell is coming out, but the burn injuries will not be present. I will discuss when the organous phosphorus, I will discuss these things, as well as the multiple petechial hemorrhagic spot over the bodies, over the faces, as the yellowish color of the faces. All these parameters suggestive of phosphorus poisoning. The liver is swollen, liver is yellow, fatty liver, ruptured liver or jaundice, features of jaundice you may see. When you are dissecting the kidney, you will see that the kidney are enlarged, greasy, yellowish color. Basically, the liver, the kidney renal failure is going on. Heart is flabby heart, pale, showing the fatty regeneration of the heart. The lungs are showing the fat emboli, pulmonary arteries and the capillaries. So, in the pulmonary artery or the pulmonary capillary, you are watching or you are observing that there will be some degrees of fat emboli are present. Now, what are the medico-legal aspects? Medico-legal aspects is very important. I have already told, in any kind of poisoning, whatever the poisons it may be, the medico-legal aspects of the poisoning is whether it is suicidal, whether it is accidental, whether it is homicidal poisons. Apart from these three types, you have to know whether it can be used as abortifacient drugs for the purpose of criminal abortion, whether it is as stupefying agents to stupefy one person. I will discuss what is stupefying agents. Stupefy one person, so stupefying drugs or stupefying medicines or agents, and cattle poisons, etc., you must know. And the aphrodisiac drugs means the drugs or the poisons which increases the sexual fantasy but not the sexual performances. So these are overall relating the medical legal aspects of the poisons, but all the poisons they does not causes all these things which I have told. So there are some specific poisons, they are producing some specific medical legal significance of it. So the accidental poisoning in the children is much more common because they are due to the chewing of the fireworks by eating the rat paste etc. accidentally. It is not preferred for suicidal poison because it is so much painful, signs and symptoms. It can be used as homicidal purpose by mixing with the alcohol or the coffee to mask the taste and smell and administer scents. The symptoms resembles like the acute liver disease if it is used as homicidal poisons. It is delayed in appearance of the symptoms, so it is a ideal homicidal poisons maybe. The poison is oxidized in the body, hence cannot be detected in the body. Death occurs after a few days. So if a person wants to kill one person with the help of this phosphorus, so they can use, but you have to know that whether there is garlic odor is coming or not. So you have to stop this smell if you want to add these things with others drinks, others substances where this odor will not be present. Next, it can be used as a abortifacient drugs. It causes a criminal abortion. It can also be used for the bomb blast, explosive substances, bullets, grenades, where incendiary bombs, where the phosphorus is used for the explosive substances. So these are the medical legal important: suicidal, homicidal, accidental, abortifacient, and you have to remember the explosive substances in the bullets, in the projectiles, in the bombs, in the ballistics for the warfare. Now the chronic phosphorus poisoning. So we have discussed regarding the acute phosphorus poisoning till now. Now we are discussing regarding the chronic phosphorus poisoning. Apart from this chronic phosphorus poisoning, you must know the short note phosphor. That is very important. That's why I have written here the chronic phosphorus poisoning, that is phosphor, short note. Very, very important short note, phosphor. So phosphor, when it is occurring, basically when the fumes of the phosphorus is entering year after years on your body in the inhalation route, then there will be the necrosis of the lower jaw through the caries teeth or the decaying teeth. So if you have the caries teeth over the lower jaw or one teeth is decaying and you are exposed in a factory of the explosive substances, the chronically the phosphorus fumes entering into the body through the inhalation route, then in the lower jaw there will be the necrosis. Initially there will be the toothache, there will be intense pain over the teeth of the lower jaw, followed by there will be the swelling of the jaw, loosening of the teeth, necrosis of the gum, and sequestration formation over the gum. From above it is entering into the deep of this bone. So firstly the teeth, soft tissue, etc., then it is entering into the mandible. So there will be the sequestration formation, osteomyelitis of the mandible, and this osteomyelitis occurs because of the pyogenic bacteria overgrowth. So there will be the multiple discharging sinus, as there is pyogenic bacteria, so increased discharge, pyogenic discharge is coming out, which is so much foul smelling discharge basically because of due to the osteomyelitis, and this is known as phossy jaw or a glass jaw. So it causes the osteomyelitis and necrosis. See the pictures from outside. Here one woman, how it looks from the externally. Here the lower jaw, how it looks. It is depressed, it is edematous, it is inflamed, there is infection. And when you are going to dissect from opening the mouth, that you are seeing that in the lower jaw, the teeth, see, there will be the necrosis over the gum, and the bones are involved, and there is osteomyelitis, sequestration, and see here there is a gap, means there is no bone here. So there is the necrosis of the bone, osteomyelitis. The pyogenic bacteria, they have already destroyed or engulfed the osteocytes, bone forming substances in the mandible. So, there will be a very bad thing in phossy jaw. So, the phossy jaw is very important short note. You please remember as short note phossy jaw, very important. This phossy jaw occurring in chronic phosphorus poisoning, when there is a increased inhalation of the phosphorus compound year by years, prolonged time, entering into the respiratory tract in the inhalation route. They are producing the manifestations over the lower jaw, predominantly over the teeth, over the gum, or in the last stage in the bone of the lower mandible in the form of osteomyelitis, necrosis, and there is a sequestration formation, foul smelling discharge is coming out, destruction of the lower mandibles as because of the overgrowth of the pyogenic bacteria. So, this is most or important. So, thank you. We are finishing here regarding this phosphorus poisoning. In the next class, we will discuss the new topic, that is the corrosive poisons. Thank you.